Hi, my name is Linda Kieferly. I'm here to validate bed bathing. I'm going to follow the 7 procedures. I'm going to get doctor's orders. I'm going to identify my patient. I'm going to wash my hands, gather my equipment, come in, introduce myself, and explain to the patient my procedure and provide for privacy. Before we do the bed bathing, I'm going to ask my patient if they need to go to the bathroom, if they need the bedpan. At this point, my patient is saying no. I have a basin filled with warm water, no soap, and I'm going to start by raising the bed to a working position.
In this case, the drip rate is 20 drops per minute, so that's what I'm setting it to.
My video is 12 weeks on, and I'm going to demonstrate how to have an
Double check your patient's name.
the necessary information. I gathered all my equipment, and once I answered the right questions of the patient, and explained I would be here, and I rectify my feet, and then I raise the bed to a comfortable working position. That I'm going to have to work on.
Remove the gown. Be careful not to dislodge any IVs or tubing.
The label and the explanation date and have to go to the order.
I this semester, okay? Drip rate is set, health assessment.
So both of them are set.
Any dirty linen will be put to the side, never thrown on the floor.
The enroll life would stay open, and the patient will receive his IV. That concludes the end of my
I'm going to start
validation.
with the
Before I end
patient's
that, I want
eyes.
to make sure that
Taking
I
my washcloth in just plain
label my
warm
tube.
water.
I want to put the date, the time,
Taking a
and
mitt.
initial it, BCCNS. I'm going to take off my gloves
I'll be washing from the inner cannula
and wash my hands. Thank you. Good. Thank you. I know. I'm
so that I'm using in a different position. Proceed to the other eye, going from the inside out. We'll wet more. Squeeze out any excess water. Make a mitt. Still no soap. Proceed to wash the rest of the patient's face, ears, patting dry,
And then we fry.
now upwards of the chest, at this point, I take my washcloth, make a mitt, squeezing out any excess water and applying soap. We'll wash the patient's chest, watching for any tubing, pegs. I'll lift up each breast, making note of any redness, irritation, getting in between any folds. Rinsing.
You gonna do it again?
Have the pad dry. Again, lifting each breast, making sure to keep any folds and underneath the breast extremely dry.
Oh my God, look.
Take my washcloth, squeeze out, soap up, touch up with the abdomen. Again, watching any tubes, pegs, rinsing, and dry.
Sorry, thank you. You're welcome.
Now we're going to take care of the patient's arms. Lifting gently at the joint. Checking the temperature of my water to see that it's still warm. Squeezing out any excess liquid, soap, holding the joint, washing. While I'm washing, I'm assessing the IV site and the skin integrity, getting into the axillary area, excuse me. Hands in between the fingers, palms, nails. Rinsing. Rinsing. Drying off. Drying off. At this point, I would raise my bed rail, go to the other side, and repeat the process on the other arm. I would continue. Once I'm done with both arms, it would come down to the legs, the leg.
Good morning. I'm going to be doing my IV validation. My name is Marcela Vasquez. First thing I would do is
Checking the temperature of my water.
check my patient's orders, wash my hands, make sure I have all my equipment and my supplies ready.
Soap, starting from the ankle up.
Check her ID,
As always, checking skin integrity.
and provide some privacy.
Washing.
I would then come over to my supplies.
Rinsing.
I would check the expiration date on my solution.
I would repeat this procedure on the other side. Pat it dry.
Then proceed to connecting my
And if my patient could, I would have them bend their legs, put their feet into the water,
spike the bag.
clean their feet, getting in between the
I would have
toes,
checked for the consistency prior to doing this.
rinsing,
Of the
take
bag,
that away,
solution in the bag,
drying thoroughly,
particulates or
especially between the toes,
any punctures or anything in the bag. I would
checking the
also
heels for their
my
integrity.
initials as well as when it was
If not, I would just continue to wash their feet without elevation underneath. At this point, if I had an assistant, I would ask them to help me, but I don't. So what I will do now is ask my patient to assist me in rolling over. Gently rolling. Watching any tubing. Again, checking my water temperature, soap, squeezing out, making a mist, washing my hands, rinsing,
compare to my patient.
dry,
Make sure that I have my gloves on. Again, I would wash my hands.
At this point, if my patient had a bowel movement, I would get paper,
Make sure that the
toilet
patient's
paper,
working.
remove the feces,
Down.
check my water, soap, make a mitt,
I would check the patient for any redness, swelling.
wiping from front to back, making note of the redness on the coxal area, rinsing, patting dry. Rolling my patient back to their original position. I would put my side rail up,
So I would clean the site.
Just dump my dirty water, get fresh water, come back, a fresh washcloth, and I would proceed to wash
For validation purposes,
perennial area.
show how we would
Water, soap, squeeze out the excess, make a mitt. Once again, always cleaning from front to back. Getting all folds, rinsing, and patting dry.
I'm going to check my drip rate.
I would then apply lotion to my patient if they wanted it. Dirty towel over here. I'm going to give my patient a clean gown. Putting my dirty bath blanket to the side on the table, never on the floor. Watching IVs. Raising rail. And covering my patient. At this point, I'm going to raise his head to provide oral care. I'm going to turn his head so that he's facing me. I'm going to take an emesis, kidney-shaped basin, some mouthwash, a disposable swab, dip it in mouthwash, squeeze out any excess, cleaning the upper palate, teeth, top of the tongue if they can handle it, underneath the tongue.
I check the physician's orders and I found the necessary hand hygiene and wear my gloves.
Dispose of the used, have them spit, get a new one
I check his ID
into the mouthwash.
and then I provide privacy.
Once again,
I raise the bed to the necessary
palate, teeth,
working position and
underneath the tongue. If my patient had dentures, I would have the dentures taken out and put into a cup soaking and still continue to rinse them out. Throw out my dirty swab, have them spit,
check its label and
Make sure that it's connected, it's not leaking.
correct order and the expiration date. So I
pat dry.
correct order and
At this point, if my patient would like lip balm or anything for their lips, I would give it to them.
When it was
I'm going to lower my bed to the lowest position. Ask my patient if they're comfortable in this position or if they'd like to lay down. If not, I will give them the call button. I'm going to take my dirty linen and my dirty wash receptacle, dispose of my linen in the cart, wash out my basin, dry it, return it to where it belongs.
providing a call down. That completes my validation. Thank you.
I'm going to document any findings that I have and also document the fact that I've given the patient a bed bath. Thank you.